Well, it's Sunday, 4 in the morning. Just got a message about a potentially emergent case that might need to go to the operating room. So I'm going to try to go look at the images now from home and see if we need to go into the hospital and do this case.
Well, I took a look at the scan, and the good news is the case is urgent rather than emergent, and there's a big difference between those two things. All right, well, the important distinction to make here is that an urgent case needs to go sooner better than later, but an emergent case needs to go right this second, and you have no time to wait. And I just got to the hospital. It is Sunday morning. It is very early, but the case needs to be done. And you know, to be totally honest with you, the case that I'm doing today is not a special case. This is not a huge surgery. This is not like a fancy surgery. This is a rather straightforward, very simple type of case. These are some of the cases that tend to have some of the best results. Less is more sometimes. And you know, you got to do what's best for the patient. And it just so happens that this is the surgery that patients tend to do the best with, but it's also a very straightforward kind of case.
2 hours later.
Okay, and that's it. Surgery's done. Every surgeon will always critique their CT scan after surgery. And it's almost like a report card of how well you did during that case. And so it's always very important to the surgeon to have a scan that looks good, but it also means that, you know, you did what you were supposed to do during the case. You know, I wanted to make sure that the CT scan looked good and that I took care of the patient. And so now I got to go to a dentist appointment. And that's it. That's call as a neurosurgeon on a Sunday. It's pretty typical.